Good morning. This is Dr. BABAK MOEIN. I'm board certified in general surgery and specialized in cosmetic surgery. Today we're going to go over submental liposuction, aka chin liposuction. What is submental liposuction? Submental liposuction is the process of removing adipose tissue in the submental area. For those people who don't know what we mean, the submental area is the area between the chin and the neck area, and it really goes all the way down. Try to encompass any area that has fatty tissue in the neck. Who is an ideal candidate for submental liposuction? The ideal candidate for submental liposuction is an individual who has excess adipose tissue in the submental neck area, and they have been concerned about this for some period of time, and they have not been able to have this dealt with through diet and exercise and other means. This procedure is simple, effective, and over time, it's stable. What are the benefits of submental liposuction? The benefits of submental liposuction is creating harmony of your face, neck, and jaw area. That brings your whole profile into picture and makes you look significantly better, brings confidence and reassurance for each individual. So how does submental liposuction differ from other fat removal methods? So submental liposuction differs from other fat removal methods because it's a significant small area. Although it's a small area, it's a very sensitive area. There's a nerve that travels right around in the lower angle of your jaw that we need to be mindful of. What does submental liposuction involve? Submental liposuction involves initially sedating the patient slightly with nitrous gas or other medication, then applying tumescent anesthetic into the tissue in the lower neck area, then prepping the patient and allowing the patient to relax, and then inserting the small little incision right underneath the chin and behind the ears, and using our micro air device or our liposuction device to perform our liposuction. At times, depending on what the needs of the patient is, we can perform laser liposuction initially to melt the fat, followed by mechanical liposuction with a device called microair. Laser liposuction is needed in patients who have had multiple previous liposuction procedures, and we choose that as our primary method to deal with patients who have had previous liposuction of their neck by other practitioners. And when it comes to folks who have significant amount of skin laxity in their neck and lower chin area, we use a skin tightening method called Renuvion J plasma system to tighten the skin and create much better contour for their lower neck area. Is this procedure performed under local or general anesthesia? Local versus general. One is you're awake and we're performing the surgery while we are relaxing you and giving you local anesthetic so you don't feel anything. General, you're completely sleeping and we place you in a state of complete relaxation, and we protect your airway by putting a tube and I'll help you breathe, and we put you under so you don't feel anything. So how long does the surgery typically take? The surgery typically takes around an hour. During this time, we do multiple steps to ensure that you're comfortable, you're safe, and we do the procedure in an effective manner. What is the expected recovery time? The expected recovery time is around 5 to 10 days. To better understand what involves the recovery for this type of procedure, you have to understand what is required to help the healing. We typically require our patients to wear a neck garment, keep the neck nice and tight so there's not excessive amount of swelling, and the garment will keep the muscle and the tissue all encompassed and pressured so there is no excess swelling and undue amount of edema in the neck. Are there any potential risk and complications of this procedure? Any procedure has potential risk and complication that you have to be mindful about, as this procedure has its own specific risk. One of the important risks that we are mindful about when we perform this procedure is to protect the nerve that travels. So we make sure that we don't damage the nerve as we're doing our liposuction. And when we get close to the area of the nerve, we use fine instruments, that means fine cannulas, so we don't damage the nerve. In addition, when we use our device that performs skin tightening, the Renuvion J Plasma device, we are very particular to make sure that the nerve is protected and we don't cause any kind of damage to the nerve by keeping away from the nerve during the skin tightening segment of the procedure. What kind of results can patient expect? Patient can expect to have significantly slimmer and thinner lower neck and submental area. I'm always impressed with the results of chin liposuction, especially because I choose my patients carefully for this procedure to ensure that the patient will get perfect results. Patient selection is at the core of having good results. A patient that has significant amount of skin laxity in their neck, they're not a good candidate for this procedure. They need to have platysmoplasty or lower neck lift. For patients who have significant amount of adipose tissue and minimal amount of skin laxity, they're appropriate for this type of procedure, and they end up having amazing results with this procedure. How soon will the results be visible? Typically, the results of chin liposuction on the table are quickly evident. That's why this procedure is phenomenal. Patients love the results being so quickly evident. Within a few days, you will get some swelling that will subside within a few weeks. Typically by 2 to 3 weeks, you can see the initial results, and the skin tightening results of the Renuvion J Plasma when it's combined is often appreciated within 1 to 2 months. Are the results permanent? This is an important question that I'm always sensitive answering. The results of any surgery is not permanent, but the results are long-lasting. Typically, when I perform liposuction of the neck, I see the results to last at least 3 to 4 years, and that is by itself phenomenal. Depending on your age, the results can last longer or last shorter. The younger you are, the results will last longer. The older you are, the results will have a less effectiveness with time. Are there visible scars after the procedure? We are very mindful to put the scars in areas that are aesthetically appropriate and not visible. The first scar is underneath the chin. That's often very hard to see. The second scar and the third scar is behind the ear in an area that's often within the fold crease of the ear, and that is not visible. What does the scar look like? The scar is often very small, less than 4 millimeters, and the scar heals very appropriately because it has no tension and is placed in an area that's easily hidden. So how should the patients prepare for surgery? Patients should prepare for surgery typically by making sure they stop all aspirin and Motrin and ibuprofen, the NSAID collection of medication, stop any type of fish oil or any herbal medication that they're taking. Patients that have any type of health-related issue, they have to communicate that with their surgeon before the surgery, depending on whether it's done with general anesthesia or with local. They have to make sure they consult their physician and check to see whether they can have a light meal or not. Under general, you have to be at least MPO, which means nothing by mouth, for 8 hours. And if you're doing under local, then you can have a light meal before the surgery. Other than that, make sure you read all the instructions and prepare for surgery based on the specific instruction provided for you by your healthcare practitioner. What post-operative care is required? The post-operative care that is required to heal after this surgery typically prefaces around making sure that you're wearing your head garment appropriately and continuously in the first 7 to 10 days after surgery. The longer you can wear your head garment, the better results you will get. I'm very particular to make sure that at least for the 7-10 days after surgery, my patients are compliant with the garment that they're wearing for their neck because it really defines their final results. This is Dr. BABAK MOEIN, Century City, Beverly Hills. Have a great